by March of 2021, more than 1.4 million residents in long-term care employees had contracted coronavirus, and over 178,000 had died. That made up about between 34 to 40% of the total U.S. population that had passed away came from these sources, right? So, I mean, they have been hit so hard. Some of them have left the industry altogether. What do you think some of the solutions are to get people to come back into the space or to recruit new people working into the post-acute space?
Yeah, I think long-term care providers have to start getting creative. I think for a long time, I mean, at least since I've been in the industry, it was very black and white as far as this is when your shift is. It's an 8-hour shift or a 12-hour shift, or whatever the facility policy is. But the workforce is just not that way anymore. A lot of people love to work at home. Now that's not a reality. We need people in these buildings.
Right.
But if you're coming from a scenario where you're working on at home on your couch, and then now you're prompted, or invited to come and work in a facility, you're going to want some concessions, right? You don't want to have to work an 8 or a 12-hour shift. Maybe you can work 4 hours on Monday and 7 hours on Wednesday and 3 hours on Thursday, whatever their schedule is. I think being creative with the workforce is the way forward. We have to really be amenable to their schedules and when they want to work, so that we can try to attract new workforce. I mean, obviously doing things like paying for school and incentives and things like that, I think are always really helpful, trying to, show betterment and, being able to work up the ladder and work on their career, I think is always a great incentive as well. But I really think just being flexible and thinking outside the normal, like 9 to 5, shift.